Gambia's Minister of Information and Communication Infrastructure said the Ministry of Health have started working on the construction of temporary treatment centers in the North Bank, Lower and Central River regions of the Gambia. Asetu Tamba has more.
The provisional COVID-19 treatment centers are supported by the country's Department of Social Welfare, the World Health Organization, and the UN OPS, an operational arm of the United Nations helping partners implement aid and development projects. The Ministry of Health currently using hotels as treatment and isolation centers, in addition to the Sanitarium and the Medical Research Council unit treatment centers. Information Minister Ibrahim Asila told in a weekly ministerial press briefing on Friday that the initiative will tackle the lack of treatment centers.
Expansion and refurbishment of Ndemban Treatment Center is in progress, and the WHO and UNOPS have already started working on the construction of temporary treatment centers at Eseu, Jarasoma, and Bansang, which are expected to be handed over on the 9th of October 2020.
With a lack of space to host every COVID-19 patient, the Ministry of Health has developed a strategy where patients in home isolation will be assigned doctors for daily monitoring. Meanwhile, in an effort to promote positive behavioral change to curb false information on COVID-19, the Ministry of Health is working with community elders to raise awareness, according to Ibrahim Asila.
In the area of sensitization and raising awareness about COVID-19, the Ministry of Health has now strengthened partnership with district chiefs, religious and traditional leaders, key influencers, and traditional communicators to communicate clearly, consistent, and reliable COVID-19 messages to promote positive behavioral change and dispel rumors and misinformation.
During the 2014 and 2015 Ebola outbreak in West Africa, the Gambia have received millions of dollars to strengthen its response, and with COVID-19 raging, the government has received millions of dollars to support its response. These were suggestions that these huge resources could have been invested in building an infectious disease hospital and to train more doctors and nurses. Ibrahim Asila said, the Ministry of Health is planning to put in place an infectious disease center, the country's first, to be funded by the World Bank. Reporting for Africa News, I am Aissatou Tamba.